Well, the art of acupuncture has been around for thousands of years, and for many, it's the answer to treating that nagging back pain. Amanda Bryant Mello is here to share some insight just on how acupuncture works. I've always wondered, always thought about trying it because I do have back issues. So tell us about acupuncture and how it works.
Well, it's not exactly, it's been around for thousands of years. It's not exactly one specific way. We can treat, it works by relaxing the body, by releasing the body's own natural painkillers, endorphins, neurotransmitters, and so that's one way that it works. And then it works by relaxing the body. We can work what we call trigger points for our sheep points, depending on where in the spine. It can be muscle, it can be leg, anywhere. Yeah, so we can treat that way locally, or we can treat systemically.
Okay, so I'm seeing what you're using here. What do you call these pins?
Well, they're needles. They're acupuncture needles. No, they're tiny. They're tiny little needles.
Okay, so tell us about these, because when I think acupuncture, I have the idea that you stick needles all over the body and that they hurt.
No.
Okay.
No,
good.
you can put them, there's like specific spots. Ears, you can do what we call distal points, like treat points in your hand that affect your low back, and that's generally how I treat. I don't necessarily put a needle in the area that's painful.
Interesting.
And so, because
just
what we're doing,
at specific trigger points that will help out?
They're trigger points, yeah. So they're very specific acupuncture points. So they can be in the hand. A lot of them are below the elbow to the hand, below the knee to the feet.
Okay, and so our producer Colleen here is going to show us how this works. You're going to, okay, so I'll let you explain.
Well, what I'm going to do today, for sake of ease, is I'm going to actually work on Colleen's ears, because ears are very relaxing. There are 5 points in the ears that are considered, there's a national acupuncture detox protocol, and it's actually very relaxing.
Oh, okay.
And there are over 150 points in the ears. So if we're talking about back pain today, there's a specific area of the ear that works on starting on the sacrum, like the sacral, like yours is low back, and you can work from the sacrum to the ilium. And this goes clear around up to actually to the neck, the cervical spine, if you want to work on that.
Okay.
But what I'm going to do is just like a general relaxation treatment, and that's another way that it can reduce the pain in the body, just by relaxing the body.
Well, and that makes sense, because usually when I'm most stressed is when I start having back issues, because I'm tensed
You're tense,
up
so it's
and
muscle tension.
Absolutely.
And so what happens when there's muscle tension, the circulation is restricted.
Oh yeah,
okay?
for sure.
And so it's like, it's a muscle cramp, it can be, and so the blood can't flow. Right. The lymphatic fluid can't flow, there's just tight circulation. So
she's ready.
Just through relaxing it, let me go ahead and, I'm just gonna put a little bit of alcohol here.
All right, so I'm gonna let you explain what you're doing over here.
I'm just gonna choose 5 points just to kind of, for a little demo.
Okay.
And it's just really relaxing.
All right. I'm going to stick a bunch of needles in your ear, but it's going to be so relaxing.
It's going to feel so good. It is, actually.
So, you know, I know this is an ancient, traditional sort of medicine or practice. Is it something like this covered by insurance?
Well, some insurances cover it. Okay. Some insurances cover it.
Did that hurt, Colleen?
No.
No?
They're so tiny.
Oh, you can't
And these are like little 1/2 inch, and they range from 40 gauge to, which is, I use a little insertion tube. Yeah. Because the needles can be so fine that they bend, and so you really don't.
By the way, you have a needle sticking in your ear right now. But you said some insurance will cover this, right? As an alternative form of medicine?
Some insurances cover it, and some don't.
Okay.
So, and actually, I wish more would, because it's so effective. I've treated a wide variety of pain. I'm just going to choose a few points here. And I've chosen, I've treated a wide variety of pain, and sometimes in as few as 3 treatments, I've saved people from epidural injections.
Oh my goodness! What does it feel like, Colleen?
I didn't feel any. It just feels like a teeny little sting.
A teeny.
But I didn't even feel the third. Yeah.
You kind of feel that. Well, I tap that little tube. I just like to use the tubes. Not everyone uses the tubes, but I like to use them.
How long will you keep these in?
I normally leave them in for about 30 minutes.
Okay.
So, and it depends. Sometimes the needle's just in and out, depending on what I'm doing. Or sometimes for pain, generally, I'll leave the needle in for 30 to 45 minutes.
And how many treatments do you suggest?
I suggest, depending on what's going on and how the patient responds. Lifestyle is really important. I say 3 to 6 visits, and you'll get a good response.
I love it. Well, I think I'm going to have to try this out, too. You can get more details or make an appointment with Amanda at springvalleysportscare.com. We'll also have her number up on our website at thebroadcasttv.com. All right, when we return, it's tips that will help you get on the right page when it comes to nutrition. It's time to stop making it complicated. Don't we all do that? Stay with us. This looks complicated, what you're saying.